Diagnostic criteria for ankylosing spondylitis. The diagnostic criteria used for ankylosing spondylitis is the modified New York criteria of 1984, which has clinical criteria and radiographic criteria. There are three clinical criteria. First is low back pain of at least 3 months duration improved by exercise and not relieved by rest. Second is limitation of lumbar spine in sagittal and frontal planes. And third is limitation of chest expansion relative to normal values for age and gender. The radiographic criteria is either bilateral sacroiliitis of grade 2 or higher or unilateral sacroiliitis of grade 3 or higher. A definite diagnosis of ankylosing spondylitis is made when there is presence of the radiographic criteria with at least one clinical criteria. So what are the radiographic grading of sacroiliitis as per this New York criteria? The grading as per this criteria is based on X-rays or conventional radiography and has 5 grades. Grade 0 is normal. Grade 1 is mild irregularity of joint margins. No erosions or sclerosis is seen here and joint space is normal. Grade 2, there are erosions and sclerosis seen. Joint space may be normal or slightly increased. Grade 3, the joint space is reduced with erosions and sclerosis. And grade 4, the joint space is totally ankylosed with the presence of sclerosis. This has certain limitations also. The criteria is not useful for early diagnosis of ankylosing spondylitis because limitation of lumbar spine motion and chest expansion are absent in early disease. Also, MRI can detect sacroiliitis much before conventional radiography. However, MRI is not taken into account in the modified New York criteria. To circumvent these problems, an ASAS classification criteria or the Assessment of Spondyloarthritis classification criteria were developed in 2009. This is better for classifying younger patients with shorter durations of back pain. So what is this ASAS classification criteria for axial spondyloarthritis? This is a classification criteria and not a diagnostic criteria. In patients with back pain more than equal to 3 months and age of onset less than 45 years, patients can be classified as patients of axial spondyloarthropathy if there is sacroiliitis on imaging plus more than equal to 1 SPA features, or if the patient is HLA-B27 positive with 2 or more SPA features. What are these SPA features? The SPA features are enumerated as inflammatory back pain, arthritis, enthesitis, uveitis, dactylitis, psoriasis, Crohn's disease or ulcerative colitis, good response to NSAIDs, family history of SPA, HLA-B27 positive or elevated CRP. Sacroiliitis on imaging is defined as active or acute inflammation on MRI suggestive of sacroiliitis associated with a spondyloarthropathy. So MRI findings of acute inflammation which appear early are taken into consideration in this classification criteria, which were not taken into consideration in the modified New York criteria. Or a diagnosis of radiographic sacroiliitis according to the modified New York criteria, which includes unilateral sacroiliitis of grade 3 or higher or bilateral sacroiliitis of grade 2 or higher according to the New York criteria. Now, this classification system has a sensitivity of 83% and a specificity of 84%. So this was a discussion regarding the diagnostic criteria for ankylosing spondylitis. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also, comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.